Heart failure and myocardial infarction are both serious cardiac conditions, each affecting the heart in different ways. Heart failure refers to the heart's inability to pump blood sufficiently, leading to symptoms such as shortness of breath, swelling in the legs, and chronic fatigue. Myocardial infarction, commonly known as a heart attack, occurs when blood flow to a section of the heart is suddenly blocked, causing symptoms like intense chest pain, discomfort in the upper body, and sweating. Treatment can range from lifestyle changes and medications to advanced interventions like surgery or the implementation of medical devices. Risk factors for both conditions include high blood pressure, smoking, obesity, and high cholesterol. Here's detailed aspects of each disease to understand their unique challenges and the impacts they have on health. Complications potential: arrhythmias versus worsening cardiac function. In the differential diagnosis of heart conditions, particularly when differentiating between heart failure and myocardial infarction, an essential consideration is the potential for complications. Heart failure, a chronic condition, often leads to progressive weakening of the heart muscle, resulting in reduced pumping efficiency. This deterioration can precipitate various types of arrhythmias, as the electrical system of the heart becomes disrupted. On the other hand, myocardial infarction, commonly known as a heart attack, is characterized by the sudden blockage of blood flow to the heart muscle. The immediate damage can seriously impair cardiac function, and if the affected area is significant, it might lead to an immediate drop in cardiac output. The scar tissue formed afterward can also impact the heart's efficiency and could be a site for arrhythmia development. Both conditions require prompt and different management strategies to mitigate these risks effectively. Primary symptoms: chest pain versus fluid retention. When distinguishing between heart failure and myocardial infarction, MI, primary symptoms are crucial. In MI, the hallmark symptom is often a sudden, intense chest pain, described as a squeezing or pressure sensation, and may radiate to the arm, neck, or jaw. This pain is due to the blockage of blood flow to the heart muscle, causing tissue damage. Conversely, heart failure typically manifests with fluid retention, leading to symptoms such as shortness of breath, particularly when lying down, swelling in the legs, ankles, and feet, and rapid weight gain due to the accumulation of fluid. These symptoms arise because the heart's reduced pumping ability causes blood to back up in the veins, leading to fluid buildup in the tissues. Recognizing these symptoms can aid in timely and appropriate medical interventions for these distinct cardiovascular conditions. Underlying cause: coronary occlusion versus progressive dysfunction. Heart failure and myocardial infarction, MI, may present with overlapping symptoms like chest pain and shortness of breath, yet their underlying causes differentiate them significantly. MI typically results from acute coronary occlusion, when a blood clot completely blocks a coronary artery, leading to tissue damage in the heart muscle due to oxygen deprivation. This event can catalyze the onset of heart failure, but is distinctly a consequence of sudden interruption in blood flow. Heart failure, on the other hand, arises from progressive dysfunction, where the heart gradually loses the ability to pump blood efficiently, often due to chronic conditions like hypertension, cardiomyopathies, or valvular heart disease. This chronic debilitation affects the entire organ's function over time, contrasting the more localized impact of myocardial infarction. Treatment approach: reperfusion versus long-term management. In managing heart failure versus myocardial infarction, MI, the principles of treatment diverge significantly. MI requires immediate intervention aimed at restoring blood flow to the heart, primarily through reperfusion techniques such as thrombolytic therapy, percutaneous coronary intervention, PCI, or coronary artery bypass grafting, CABG. Quick reperfusion minimizes heart muscle damage and preserves cardiac function. Contrastingly, heart failure, an ongoing condition where the heart can't pump effectively, necessitates a long-term management strategy focusing on lifestyle changes, medication to reduce workload on the heart, and in some cases, device implantation or surgery to improve heart function. Its complexity often requires a multidisciplinary approach for optimal disease management and patient quality of life. Complications potential: arrhythmias versus worsening cardiac function, heart failure and myocardial infarction. While both cardiac events have distinct implications concerning complications potential. In the aftermath of a myocardial infarction, also known as a heart attack, the immediate concern is the development of arrhythmias. The sudden interruption of blood flow to the heart muscle can lead to abnormal electrical impulses, resulting in rhythms ranging from benign extrasystoles to potentially fatal ventricular fibrillation. On the other hand, heart failure, a chronic condition characterized by the heart's diminished capacity to pump blood, puts patients at risk for progressive worsening of cardiac function over time. This deterioration can lead to a vicious cycle of decreasing cardiac output and escalating heart failure symptoms, requiring intricate management to prevent acute decompensation and secondary organ failure. Both conditions demand vigilant monitoring and proactive intervention to curtail these severe complications.